You can simply pause the video and you can try to find out what is the problem in this particular ECG. Now, when we try to see in this ECG, that we can very easily see that uh, the QRS complexes are there. We can very nicely make out QRS complexes. The P wave is very small, but it is very well appreciated. Like there is small bump, which is P wave, and it is around almost exactly around 5 small squares distant from QRS. So the PR is almost as good as, like, it is okay. It doesn't look prolonged. The other things which appear in this ECG is, we know that the P wave is there. PR doesn't look prolonged, especially if you see it here, that there are around 4 boxes in between the P and QRS complex. So PR is not definitely prolonged. Here it slightly looks prolonged. This is P wave and this is QRS complex. So there are exactly around 4 to 5 small boxes. So up to small 5 boxes or zero point 0.2 second is perfectly fine, and more than that is what we call it as prolonged PR. But if you try to see, we are not able to see any T wave here. So actually here the T wave is there. It is there, but it is very flat. Compare the QRS complex. It is pretty well present here. But in V2, V3, the T wave is there. In V4, the T is there, but it is very small. In V5, the T is not very well appreciated. You can see that the T is almost not there. It is very, very, very flat. It is almost touching to the baseline. And in V6 also, the T wave is almost not there. It is very flat, or it is touching to the baseline. If we see the limb leads, like in lead AVR, AVL, it is almost like flat. There is no T wave at all. The T wave is not there at all. Though we can very well appreciate the P wave, QRS complex, but the T wave is not at all there. So we know very well that the T wave is a repolarization wave, and a T wave, for the repolarization, one of the most important ion is potassium. So if potassium is deficient, then what commonly you get is low voltage complex. Low voltage complex means in this limb leads, the QRS will be less than around 5 millimeter in height, whereas in the chest leads, it may be around less than 10 millimeters in height. So here it is more than 10 millimeter. The QRS are pretty good, because here also we can see it is 5, 5 and 4. So QRS complex is good. But the other things which very commonly you see in hypokalemia is the flattening of T wave. So flattening of T wave is one of the most earliest sign of hypokalemia. So in this particular ECG, where the P is prominent, QRS is very, very, very prominent, but the T is apparent only in 3 leads out of the 12 leads. In all the other 9 leads, the T wave is almost flattened. The next thing, if the potassium worsens, or if there is worsening of the hypokalemia or reduced potassium levels, then there will be T wave inversion, and after that the patient will have ST depression. So those are very, very typical changes if the potassium keep on worsening. In this particular patient, the potassium was 2.8 milliequivalent. Normally it should be in between 3.5 to 5.5. So any ECG having a flat T wave, or T inverted T wave, or ST depression, or low voltage complex, you should always think of hypokalemia. So flat T wave, or T inversion, or ST depression, and the last one is low voltage ECG. These are very, very typical changes of hypokalemia that we should always consider and should always be corrected. Thank you.